Liver disease. 8 warning signs of fatty liver disease and what causes it. Fatty liver disease is a condition that is much more common than many people realize. Millions of individuals suffer from it, often without knowing it's happening. The liver is one of the body's most essential organs, responsible for filtering toxins, metabolizing fats, and creating important proteins. However, when excess fat accumulates in the liver, it can lead to impaired liver function and pose serious health risks. In this VIDE, we will explore the 8 warning signs of fatty liver disease and dive deep into its causes to help you understand and prevent this condition. What is fatty liver disease? Fatty liver disease, or hepatic steatosis, occurs when excess fat accumulates in the liver. While having a small amount of fat is typical, it becomes concerning when fat makes up over 5 to 10% of the liver's weight, leading to this diagnosis. The condition is categorized into 2 primary types: non-alcoholic fatty liver disease, NAFLD, which is unrelated to alcohol consumption, and alcoholic fatty liver disease, AFLD, which is caused by excessive drinking. Both types can result in liver damage if not addressed. Non-alcoholic fatty liver disease, NAFLD. This form develops in people who consume little to no alcohol. It is the most prevalent type of fatty liver disease and is often related to obesity, type 2 diabetes, and metabolic syndrome. Alcoholic fatty liver disease, AFLD. This type is caused by excessive alcohol consumption. Over time, alcohol can lead to fat accumulation and liver damage, potentially resulting in more severe complications if alcohol consumption continues. In the early stages, fatty liver disease can often be reversed with lifestyle adjustments. However, if it goes untreated, it can progress into more serious forms, such as non-alcoholic steatohepatitis, NASH, liver fibrosis, cirrhosis, or even liver cancer. Identifying the signs and understanding the causes is essential for early intervention and prevention. 8 early warning signs of fatty liver disease. Fatty liver disease tends to develop slowly and without many initial symptoms. As more fat accumulates in the liver, symptoms may begin to appear. Here are 8 common warning signs. 1. Feeling constantly tired or weak. One of the first signs of fatty liver disease is ongoing fatigue or a general sense of weakness. This occurs because the liver, overwhelmed with fat, struggles to perform its many vital functions, including detoxification and metabolism of fats. As a result, the body may feel drained of energy. Why this happens? The liver plays a key role in producing energy. When its function is impaired, the body's ability to maintain energy levels diminishes, leading to chronic tiredness and low stamina. Second, pain or discomfort in the abdomen. People with fatty liver disease may feel pain or discomfort in the upper right area of the abdomen, where the liver is located. This pain is often described as dull and persistent, worsening as the liver becomes more inflamed due to fat accumulation. Why this happens? As fat builds up in the liver, the organ may enlarge, stretching the surrounding tissues and causing discomfort or a feeling of fullness. 3. Unexpected weight gain or loss. Fatty liver disease can cause sudden, unexplained changes in body weight. Some people may experience weight loss because their liver isn't metabolizing fats correctly, while others may notice sudden weight gain, which is often associated with obesity and related metabolic issues. Why this happens? When the liver's ability to process fats, proteins, and carbohydrates is disrupted, it can lead to changes in weight, as well as other metabolic disturbances. 4. Swelling in the abdomen or legs, edema. As the condition advances, fatty liver disease can cause fluid to accumulate in the abdomen, a condition called ascites, and in the legs, edema. These symptoms are often an indication of significant liver damage. Why this happens? A healthy liver helps maintain the balance of fluids in the body. When the liver becomes damaged, fluid may accumulate in tissues, causing swelling in the abdominal area and legs. 5. Yellowing of the skin and eyes, jaundice. A telltale sign of liver problems, jaundice is the yellowing of the skin and the whites of the eyes. This occurs when bilirubin, a yellow pigment produced by the liver, builds up in the blood due to impaired liver function. Why this happens? When the liver is damaged and cannot break down bilirubin properly, this pigment accumulates, leading to the yellow appearance characteristic of jaundice. 6. Dark urine or pale stools. Changes in the color of urine and stools can be another warning sign. Dark-colored urine and pale or clay-colored stools often point to liver dysfunction. Why this happens? The liver is responsible for producing bile, which helps digest fats and gives stool its characteristic color. If bile production is impaired, it can lead to pale stools. Dark urine is often caused by an increase in bilirubin levels in the blood. 7. Visible spider-like blood vessels on the skin. People with fatty liver disease may notice the appearance of spider angiomas, which are small clusters of blood vessels visible on the surface of the skin. These typically appear on the face, neck, chest, and arms. Why this happens? Liver damage can affect the body's ability to regulate blood clotting and vascular health, leading to the formation of visible blood vessels near the skin's surface. 8. Mental confusion or difficulty. Concentrating. As fatty liver disease progresses, it may lead to a condition called hepatic encephalopathy, which causes confusion, memory problems, and trouble concentrating. This happens when the liver is unable to filter toxins from the bloodstream, allowing them to build up and affect brain function. Why this happens? A malfunctioning liver cannot adequately remove toxins like ammonia from the bloodstream, which can lead to cognitive issues and confusion. Key causes of fatty liver disease. The causes of fatty liver disease differ depending on whether the condition is alcoholic, AFLD, or non-alcoholic, NAFLD. Below are some of the most common causes and contributing factors. 1. Obesity. Obesity is one of the most significant contributors to non-alcoholic fatty liver disease. Excess fat, especially around the abdomen, is strongly linked to fat accumulation in the liver. Obesity is also closely tied to insulin resistance, which can further damage liver function. Why it matters? Insulin resistance associated with obesity often leads to metabolic complications, making the liver more susceptible to fat buildup. Second, type 2. Diabetes. Individuals with type 2 diabetes have a higher risk of developing NAFLD. Insulin resistance is a key factor in diabetes and leads to improper fat storage in the liver, exacerbating fat accumulation and increasing the likelihood of fatty liver disease. Why it matters? Insulin resistance affects both blood sugar control and fat metabolism, significantly increasing the risk of developing fatty liver. 3. High cholesterol and triglyceride levels. Elevated levels of cholesterol and triglycerides in the bloodstream can contribute to fatty liver disease. Excess fats from the blood are deposited into the liver, where they accumulate and lead to hepatic steatosis. Why it matters? Managing cholesterol and triglyceride levels through diet and medication can help reduce the risk of fat buildup in the liver. 4. Excessive alcohol use. Alcoholic fatty liver disease is directly caused by long-term, excessive alcohol consumption. Alcohol interferes with the liver's ability to process and break down fats, leading to fat storage within the liver cells, and over time, more severe liver damage. Why it matters? Reducing alcohol consumption or quitting entirely can prevent the progression of alcoholic fatty liver disease and improve liver function. 5. Metabolic syndrome. Metabolic syndrome is a cluster of conditions, including high blood pressure, high blood sugar, abnormal cholesterol levels, and excessive fat around the waist that increases the risk of heart disease and type 2 diabetes. These conditions also elevate the risk of developing fatty liver disease. Why it matters. Addressing metabolic syndrome can help prevent the onset of NAFLD by managing the underlying conditions that contribute to fat accumulation in the liver. 6. Unhealthy diet. Diets high in processed foods, refined sugars, and unhealthy fats are a significant risk factor for fatty liver disease. Regular consumption of sugary drinks, fast food, and trans fats contributes to insulin resistance, obesity, and fat buildup in the liver. Why it matters. Switching to a healthier, balanced diet that includes whole grains, lean proteins, and vegetables can help reduce the risk of developing fatty liver disease. 7. Genetics. Genetics can play a role in fatty liver disease. Individuals with a family history of liver disease, obesity, or type 2 diabetes may be more susceptible to developing the condition, even with otherwise healthy lifestyle choices. Why it matters. Understanding your genetic predisposition to fatty liver disease can help you take early preventive steps, such as maintaining a healthy diet and regular exercise. 8. Rapid weight loss. While weight loss is often recommended to prevent or manage fatty liver disease, losing weight too quickly can have the opposite effect. Rapid weight loss through crash diets or certain types of bariatric surgery can cause the liver to become overwhelmed with the release of fatty acids, leading to fat storage in the liver. Why it matters. Gradual, sustained weight loss is healthier for the liver and allows it to metabolize fats at a manageable rate. Fatty liver disease is a serious condition that often goes undetected until it has progressed to more advanced stages. Recognizing early warning signs such as persistent fatigue, abdominal pain, jaundice, and changes in urine or stool color can help ensure timely diagnosis and treatment. By understanding the causes, such as obesity, diabetes, high cholesterol, and excessive alcohol consumption, you can take proactive steps to prevent or manage fatty liver disease. With the right lifestyle changes, including a healthier diet, regular physical activity, and avoiding excessive alcohol consumption, fatty liver disease can often be reversed or managed. If you notice any symptoms or have risk factors for liver disease, it's important to consult a healthcare provider for further evaluation and guidance. Taking care of your liver is essential for maintaining overall health and well-being.